All right. Thank you very much. Thanks for joining me today. While students are home learning remotely, our province continues to directly tackle the COVID-19 pandemic. While we all want in-class learning to return this spring, we will not take risks with your child as we respond to high rates of COVID-19 in the community, intensive care units overwhelmed, and variants seamlessly entering from our porous international borders. But I want to assure parents that we will continue to work with and seek the advice of the Chief Medical Officer of Health on the way forward. The arrival of vaccines means there is hope on the horizon. As of May 6, I'm proud to confirm that remaining education staff who typically work in person in our elementary and secondary schools are eligible to register for a vaccine. And by May 25th, every Ontarian 18 and over will be eligible. This is the progress we need to defeat this pandemic. Since last fall, we have been forward planning for a safe return to school in September. We've heard firsthand from experts, from parents, and students themselves. This pandemic has been tough on children, their mental health, and adverse impacts to reading and math skills. This past year, we put in place a $1.6 billion plan to deliver safe and quality learning. We led the nation in investment and objectively with the most advanced and comprehensive plan. From masking to testing to the screening and cleaning in our schools, in every measurement we have led. And Ontario stands alone in Canada with a strong online learning infrastructure. We stepped up from the spring of 2020, higher standards and a more quality learning experience for your children. As we look to September, be assured, our Premier and government is pulling out every stop to ensure students are safe and quality learning is maintained. Today, I'm proud to announce that the government is making the single largest investment in public education in Ontario history. Our government is making over $2 billion in resources available to protect students and strengthen learning in the classroom. Le plus important investissement ponctuel dans l'éducation publique de l'histoire de l'Ontario. Since coming to office, our government has increased funding for public education each and every year. And I'm proud to note that we are once again increasing education funding projected to total $25.6 billion through the Grant for Student Needs. This is an increase of more than $561 million for next year alone. And we are going further. Under our plan, Ontario is providing an additional $1.6 billion in targeted COVID-19 resources that will ensure we invest more in mental health, more in reading and math supports than at any point in our history. Under our plan, our government is investing in mental health, special education, reading supports, and math supports. For children with special education needs, Ontario will provide school boards with $3.21 billion to support those students and give them the resources that they deserve. Again, the highest investment in Ontario history. In addition to the Grant for Student Needs and the COVID-19 $1.6 billion in resources, Ontario will invest more than $288 million in the Priorities and Partnership Fund to enable school boards and third parties to undertake important curricular and extracurricular activities that advance student success. Our investments will support student success in mathematics, promote positive mental health, and ensure students from Indigenous and racialized communities, those with disability, and from low-income families get the support, specialized supports that they will need. Now, around the world, many students have experienced regression in literacy, numeracy, and mental health. And both here at home and abroad, some students are becoming increasingly disengaged from learning. We recognize this is a historic impact faced by a generation of learners and educators. To that end, we have built a learning recovery and renewal plan to help them overcome the difficulty that this pandemic has created. That's why we're unveiling Ontario's Learning Recovery and Renewal Plan for students, $85.5 million in dedicated funding for students in addition to the other funding available through the Grant for Student Needs and the Priorities and Partnership Fund. As part of our plan, we partnered with School Mental Health Ontario to provide targeted professional learning opportunities for educators and mental health professionals to support student learning. Our government will provide mental health promotion and prevention supports to all students, and offer timely clinical interventions for students that require school-based health services. This investment can fund up to 1,000 mental health workers supporting our schools. We're also extending access to school-based mental health services through the summer to ensure therapy can continue without interruption, a key request of so many families in Ontario. In fact, we're dedicating over $80 million in funding for mental health. That is more than 4 times the investments made in 2017-18 under the former Liberal government. Now, for the youngest learners, we're providing resources for reading assessment supports and local programs so educators can identify the learning needs of their children and support their reading skills. This coming year, we're going to continue to invest in our $200 million 4-year math strategy to promote student success in math and partner with school boards to support student re-engagement. Our goal is to work closely with the education sector to ensure that safety and well-being of academic success of students remains front and center. Our plan recognizes the generational challenge we face and marshals all resources to keep students safe while investing heavily in learning recovery from literacy to numeracy skills. With the necessary precautions in place, Ontario's Chief Medical Officer of Health has confirmed that schools are safe. With this record investment and by continuing to act on the best advice of the medical professionals, we intend to keep them that way while setting students up for academic success. As our vaccine rollout continues, we have every reason to be hopeful for the next school year. But we have made these resources and investments, taken these steps because we recognize that keeping our schools safe must be our top priority. Today's announcement is intended to ensure that we're prepared. And I want to thank our education partners for their continued quick and nimble action as we work together to defeat this pandemic. Finally, I want to acknowledge and conclude with a note of thanks to Ontario students, parents, education staff, and school boards for their strength and their hard work throughout this pandemic. Having joined countless virtual classrooms, I can only say I beam with pride in Ontario students. I want to thank you for being here today, and I'd now like to call Katherine Hay, the President and CEO of Kids Health Phone, to offer some remarks. Thank you.
Thank you so much. Good afternoon. Thank you, Minister. I am so pleased to be here on behalf of Kids Help Phone to help raise awareness of the many resources and supports we have available to support the mental health of young people across Ontario. It is both Education Week and Mental Health Week, which makes it a perfect time actually to express our gratitude to this government and to the Ministry of Education for continuing to provide critical funds that support youth and mental health, which is vitally important for students right now who are facing unprecedented challenges. I want to also thank the thousands of Ontarians who responded to our call for help last year and joined our volunteer team of crisis responders to our texting platform, supporting young people across Ontario in need. Since the beginning of the pandemic, we've seen an increase in demand for our service and support to over 1.2 million connections with young people in Ontario, more than double from the year before the pandemic hit. We really are, as a province, in this together. It is a combination of donations, corporate support, government support, and our community of volunteers who make it possible for us to be here for students any time of the day or night. No issue is too big, no issue is too small, even at 2 in the morning. In the past year, young people have needed us like never before, and the need is not slowing down. The top issues this past year included stress, anxiety, depression, relationship challenges, suicide, and self-harm. This past year alone, we conducted almost 1,300 active rescues with young people in suicide ideation across Ontario. That is almost 1,300 lives saved, families and communities that did not experience this tragedy. Conversations with young people continue to evolve as they are impacted by COVID. We've heard from those who are simply scared of the virus. They're afraid of losing their parents, their grandparents, family members, friends. That's a lot of fear for our kids and students in Ontario. Many youth talked about being isolated at home and sometimes actually in an unsafe environment. Others talked about missing out on celebrating milestones like birthdays and graduations with family and friends. This is loss and grief for our kids in Ontario. We also heard from young people who reached out struggling with body image, eating disorders, gender and sexual identity, and substance abuse. As the only 24/7 bilingual national e-mental health service for youth in Canada and Ontario, young people can reach out for help every single day. Thanks to the ongoing funding from the Ministry of Education, the support of our donors and volunteers, Kids Help Phone will continue to be there when, how, and where kids need us. No issue is too big or too small. We are always here. Thank you so much, Minister.
Thank you so much. I now like to call up my colleague, the Parliamentary Assistant to the Minister of Health and the MPP for Eglinton Lawrence, Robin Martin.
Thank you so much, Minister Lecce, and I just want to say as well thank you to Katherine Hay for giving us her perspective and all the work that she's doing. Throughout the COVID-19 pandemic, our government has been working very hard to support parents and families. And over the past year, we have made critical investments in our schools to ensure a safe learning environment. These funds have been used to hire additional teachers, custodians, and staff in schools, to hire public health nurses, to support initiatives to improve student mental health, and to enhance our school infrastructure, including improvements to air quality and ventilation. We've also provided considerable direct financial support to families through the Support for Learners, Support for Families, and the Ontario COVID-19 Child Benefit programs. These benefits have been very well received by families in my riding, and I know my constituents very much appreciate the doubling of the current round of payments announced in the budget to $400 per child and $500 for a child with special needs. I know they will also welcome the news that the 2021-22 grant for student needs will be rising to the highest ever per student amount in Ontario's history, and the government making more than $1.6 billion available to schools and school boards to address the challenges posed by the COVID-19 pandemic. And as Parliamentary Assistant to the Minister of Health, I am particularly excited, I have to say, about the emphasis being placed on support for student mental health, which we all know is critically important, especially when it comes to addressing the impacts of the COVID-19 pandemic on our students. I know the Ministry of Health will continue to work closely with Minister Lecce and the Ministry of Education to help promote a safe learning environment for all of our children going forward. Thank you.
Okay.
We'll go to the phone lines for questions. Just a reminder, it's one question and one follow-up. First question.
From Christina Tanelia at CP24. Please go ahead.
Hi, Minister. Hi, everyone. Thanks for taking my question.
Thank you.
Minister, today's announcement is on mental health supports for students, and as you know, Kids Hospital experts have noted in their studies that a large majority of children have been experiencing mental health struggles arising from the loss of in-person social interaction, which means not being in the classroom. So on that note, when will in-class learning resume? And I recognize in the past you've been vague with these timelines and the criteria or the measurements for a return to the classroom. So if you won't answer when in-class learning will resume, if you can share when you expect or when you will receive direction or an update from Dr. Williams on the matter.
Yeah, I appreciate the question, and I know, for so many people in the province, we want to get kids in school. But look, the fact of the matter is the Chief of the Medical Officer of Health of Ontario's advice has not changed to the government. We continue to face real issues in the province of Ontario, high rates of community-based transmission, and our intensive care units continue to face incredible levels of stress. And that's why the province took action, extending the state home order, taking action at our border, and of course trying to work to reduce transmission within the community that is creating a significant impact on a variety of us, including for our schools and for workers and for so many parents across Ontario. His advice has not changed at this point. The part of today's announcement is a recognition that we have a responsibility in government to plan ahead for September. We've been doing that for months. It's why we're unveiling a plan today that preserves choice for families, for virtual learning and in class, a plan that allocates $1.6 billion of provincial dollars to protect the safety of children and help them recover from the learning loss that we've realized at home, and we're seeing it around the world. And it's why we're partnering with incredible groups like Kids Help Phone and School Mental Health Ontario to provide the best mental health supports and access to those supports possible.
Follow up?
Okay, then perhaps, Minister, you can give direction on this. So, ETFO President Sam Hammond said recently, the move to virtual learning was never intended to be permanent. It was a temporary measure intended to deliver emergency instruction during a global health crisis. So recognizing that virtual learning will be an option for students for the 2021 to 2022 school year, I'm wondering, will remote learning be a permanent part of the public school system after the 2021 to 2022 school year?
Yeah, we've committed ourselves to consulting on providing that choice beyond this year. What we heard in the consultation absolutely clearly is that parents want that choice for this September because we're unsure of where this pandemic will take us. Well, I think we all have a sense of hope. With vaccines really rolling out in the province, there's some light at the end of this darkness as we look forward. But the truth is, what we heard is parents want the choice for this September. What I can confirm too is we are ensuring every board in Ontario will provide that choice, a virtual learning experience, and we've asked them to provide more time to parents to make that choice. That's what we're confirming today, and I think that's important for families as they look forward to September.
Next question.
From Chris Rushwe at Toronto Star. Please go ahead.
Thank you. Just following up on Christina's question, will you or do you think you should at some point give parents some kind of date or deadline by which you will definitively let them know if kids will be returning to in-person classes before the end of June? Is that something you'll do?
We're going to follow the advice of the Chief Medical Officer of Health. His position has not changed on this matter, but obviously as soon as more information becomes apparent to the province, we'll communicate it so families know. I think that's a reasonable expectation. We'll continue to do that as we have, but as it looks today, the province faces real challenges. High rates of community-based transmission, ICU capacity that is really stressing our hospitals, and we continue to have root causes not being solved in the context of gaps at our international border, the fact that that still remains a outstanding liability where variants now represent 90% of the cases in Ontario. They're more transmissible, they affect younger people. This is a concern, and that's why in the immediate term our focus really is on just ensuring mental health supports are there for kids today, that they're able to access a teacher with the highest standard of live, synchronous, or Zoom-style learning in the country at 75% of the day for kids grade 1 and up and 50% for kindergarten. We did that to ensure the continuity of learning, to ensure children continue to get access to a teacher. And of course, we're emphasizing that mental health supports are there for families and kids that need it most.
Follow up?
Thank you. I'm just wondering how you would feel about targeted reopenings of schools. So if that's a possibility that schools could reopen in areas that have very low COVID numbers?
We are obviously going to continue to lean into and adopt the best advice of the Chief Medical Officer of Health. We've consulted with sick kids, with medical officers of health, with a variety of leaders in health promotion and in infection prevention. And obviously, when that advice comes to government, we'll be able to communicate on it. At this point, really what today's announcement is about is looking forward to September with the right investment in place, with the province stepping up with a $1.6 billion resource allocation to help those in our schools and to ensure kids continue to have choice to online learning. And obviously, as the Chief Medical Officer of Health provides advice on the more immediate term, we'll make sure parents know it.
Next question.
From Sean Jeffords at the Canadian Press. Please go ahead.
Good afternoon, Minister.
Hi there.
Wanted to follow up on the questions about the school year, this current school year. You are painting a very grim picture. I mean, the statistics paint a very grim picture that we see every day of the pandemic picture in the province. Given that, wouldn't it frankly just be wise to tell parents right now, this school year is done, we're starting to plan for the next year, and we're going to do online learning for the rest of this current school year? I mean, what optimism do you have that class could actually resume in person this academic year?
That decision is going to be informed by the advice of the Chief Medical Officer of Health, and his opinion to the government has not changed in the matter. While the data points continue to, I think, raise great concerns, it's why the province has taken such decisive action, and the Premier has led with ensuring that we reduce transmission in community and workplaces, obviously extending the state home order, the state of emergency, and making sure that testing becomes more available within workplaces across Ontario. All of this is designed to fix the problem, reduce transmission in the community so that we could all have a more normal spring and summer. But obviously, that advice has not changed at the present. And when we get updated advice, I assure families, for parents out there, you will know it. But I also want to assure families that I think are also looking forward a bit to September, that we are prioritizing education workers in our vaccine framework. All childcare workers have had access since last week to book an appointment, and educators this week, all of them, within our schools. That is promising. We also are making sure that we've got a plan for learning recovery, for mental health promotion, and for supporting areas that we've seen regression around the country in math and in reading. So we are very much targeting September with the aim of ensuring it is safe, it is more normal as the extent humanly possible, and we're going to continue to do what we did this past year, which is listen to the best expert advice, because it's not a coincidence that Ontario has one of the lowest case rates in the nation for youth under 20. It is because we adopted the best advice of the Chief Medical Officer of Health. It's because we put the resources in place to hire 7,000 staff, to ensure 95% of schools have made some upgrade to their air ventilation systems, to procure 33,000 HEPA units, to have over 180,000 more tablets out there, and 10,000 internet connections. That happened because we started working the minute this pandemic started in the first wave, preparing for the challenges we face in Ontario. And because of that planning, we have been able to pivot in class, online, and back based on the community transmission reality. I think that is important, that we continue to build upon that as we look to September.
Follow-up?
Minister, on the continuation of online learning next academic year, do you plan at some point to order a pullback on that policy over the course of the school year, even though it will be available, because of broader vaccine coverage and on the assumption that the pandemic recedes or decreases rather?
Yeah, look, I think our long-standing position is parents are best positioned to make the best choice for their kids. We trust moms and dads in Ontario to decide what makes sense for their home, for their household, given that they may live with intergenerational families, they may have immunocompromised siblings. That is a personal choice, and I don't think government is best positioned to make it for parents. Parents can make that decision. What I heard clearly is given the fact this pandemic creates massive disruption and challenges for families today as we deal with the third wave, what was important is that we provided that choice for this September for the coming school year, and that we provided more time to parents to make that choice, which is precisely what the announcement does. That's what we're announcing today. We're consulting on anything above and beyond that, as I've noted in the past, but we do think choice is a strength. Ontario is one of the only provinces that had a province-wide online learning system with that high standard, where we helped procure, we're talking about over 100,000 new devices, where we were able to extend internet to all elementary schools, and we're on track to complete them to every high school in Ontario for this September. We've been able to improve professional development, raise the standard of learning, set a high 75% minimum of the 300 days of instruction must be live learning. So we did that by design to ensure your child continues to learn. That's what's important. No matter what happens in this pandemic, that they're able to access their teacher that have been incredibly supportive to so many children in Ontario. We want to maintain that, and that will be the case for this coming school year.
Next question, and this will be the last question.
From Dave Woodard at Global News, please go ahead.
Good afternoon, Minister.
Hi there.
With remote learning and cohorting being offered for the entire 2021-22 school year, Does that mean that you're expecting to have the same issues as we've seen this year, despite the fact that at least all teachers will have access to the vaccine at that point?
We're going to be planning, and we're asking school boards to plan for all circumstances as we did last year. The cohort adoption model, if you will, the more normal return to school model, and online. We're doing that because it is prudent and necessary for us to think ahead of what circumstance could be thrown at Ontario and how do we ensure children continue to learn. That's I think, an important lesson learned, is to be ready for any circumstance and eventuality thrown at this province and country. And we're trying to, at a more macro level, prevent a fourth wave. I mean, while we deal with the third wave today, we're also really taking action and calling for partnership at the federal level to help fix some of the outstanding challenges at the border and the gaps that remain to prevent a fourth wave, so that we're, I think the basis of your question, we're able to have a more normal social experience for children, where they're able to interact and have extracurriculars and physical education. These are the important elements that the medical community has said we really think it needs to be integrated in learning next year. And that is our ambition. That's our commitment, is try to restore that new normal, given that vaccines will be available for all educators and, to be fair, all Ontarians 18 plus by the end of this month, and potentially for young people, as Health Canada may approve vaccinations for those as below 16. So that is what our plan is built on, is being ready for any circumstance with the $1.6 billion provincial fund available so that kids continue to learn, they get access to a teacher, they get more mental health supports, and a specialized focus on helping make up the gaps in math and in English, and really to help vulnerable children, racialized children from low-income families, children from the special education communities that have really disproportionately borne the challenge of COVID-19. And that's why we increased investment in mental health, 4 times that the Liberals were spending in 2017-18, over $3 billion in special education supports, the highest levels reported to date. We're doing that because we want these kids to succeed. We want them to recover from the great difficulty of this third wave.
Follow up, and this will be the final question.
Following up on some of the questions my colleagues have asked you, you talk about waiting for the Chief Medical Officer of Health to make a decision on schools reopening. Right. You say that the advice has not changed. But based on what you know and what we're seeing, what kind of confidence do you have that school classes will resume this year? And why wouldn't you communicate that today?
Look, the Chief Medical Officer of Health continues to analyze the data and provide advice to government. To date, I think he has not changed his position on the matter because, like we all see, our hospitals face great levels of stress, the highest number within our ICU, over 3,000 to upwards of 4,000 cases a day. The Premier's commitment is to not take a risk with your child, is to not compound the problem, especially until we fix the root cause of this issue. And it's why we continue to stress, in addition to taking action in Ontario, which we have done successively over the past months, to extend the state home order, to improve the safety of workplaces, to bring vaccines into our workplaces, to expand testing, asymptomatic and rapid. All of these actions have been designed to help stem this third wave, but we still need support, cooperation, and action from the federal government to fix the root cause of this problem, which continues to be a porous border, an international border allowing variants into the country. 90% of cases in this province are variants of concern. They came to this province through our land borders and obviously in part from our airports. There's 150,000 people came to Canada over our land borders over that 2-week period. So we have to take action, and we're calling on the feds to do it so that we can prevent a fourth wave and so that we can get kids back into class in a more normal, humane, positive experience where they're able to socialize, where kids can be kids. That's the ambition. It's why we put in place the investments, but we need the support of the feds to get this done. Okay. Thank you so much.